Today, we're going to dive into something incredibly important for our health, something that often gets overlooked. We may not always think of our legs and feet as signals for our overall well-being, but they can be powerful indicators of what's happening inside our bodies. Whether we walk, run, or simply go about our day-to-day routines, our legs are always working for us. And their health is directly linked to the condition of our blood vessels. When the blood flow in our legs is interrupted or compromised, it can be the body's way of telling us that something deeper is going on, possibly even related to our heart or brain health. Our bodies have an intricate network of blood vessels, and those in our legs and feet are no exception. These vessels are responsible for delivering oxygen and nutrients to every muscle, bone, and tissue. When everything is running smoothly, we don't even notice the miracle of our circulatory system at work. But when something goes wrong, like when the arteries begin to narrow or get blocked, we start feeling the effects. And these effects can be much more serious than just discomfort. They are potential warnings of peripheral arterial disease, PAD, a condition that signals trouble not just in our legs, but across our entire circulatory system. We've all experienced muscle cramps from time to time, whether from overexertion or dehydration. But the kind of cramping that should make us stop and pay attention happens when we walk short distances and suddenly feel an overwhelming need to stop because the pain is too intense. This isn't normal muscle fatigue. It's a signal that our muscles aren't getting the oxygen they need. And when muscles don't get oxygen, they can't function properly. The pain is our body's way of telling us that the blood flow isn't right, most likely because those blood vessels have narrowed to the point where oxygen can't get through effectively. Peripheral arterial disease isn't something to brush off. It's a condition that can start subtly, with cramps or fatigue in the legs, but if left untreated, it can evolve into something far more serious. Imagine trying to drink through a straw that's clogged. No matter how hard we try, very little liquid gets through. That's exactly what happens to our blood vessels when plaque builds up inside them. The blood struggles to flow, and as a result, the muscles in our legs don't get what they need to keep moving. When blood flow is restricted like this, it's not just a localized problem in the legs. Our circulatory system is all connected, and issues with blood flow in one area of the body can be a sign of more widespread problems. The same narrowing of blood vessels that occurs in the legs can happen in other areas, including the heart and brain. This is why addressing these symptoms early is so important, not just to improve mobility and reduce pain, but to protect our long-term health. When left untreated, PAD can increase the risk of heart attack, stroke, and even cognitive issues like vascular dementia. Thankfully, modern medicine offers a variety of solutions. If we recognize these warning signs early and consult with a vascular specialist, we can undergo diagnostic tests to pinpoint where the problem lies. Doctors can use advanced imaging techniques to identify blockages, and depending on the severity, procedures like angioplasty may be recommended. In this procedure, a small balloon is inserted into the artery and inflated to push aside the plaque, restoring blood flow. In some cases, a stent, a tiny wire mesh tube, may be placed to keep the artery open long-term. These interventions can be life-changing, preventing further complications and significantly improving our quality of life. However, addressing PAD isn't just about treating the immediate symptoms. It's a wake-up call. When we're dealing with arterial blockages in the legs, it's often a sign that similar blockages could be present elsewhere. We need to approach this from a whole-body perspective. It's not just about fixing one area, but about making lifestyle changes that support our overall vascular health. This includes managing risk factors like high cholesterol, high blood pressure, and smoking. which can all contribute to the buildup of plaque in our arteries. Taking care of our circulatory system doesn't just start when symptoms appear. It begins with the small daily choices we make. Staying active, eating a heart-healthy diet, and managing stress can all play a huge role in keeping our blood vessels healthy. And if we start to notice changes, like cramping or fatigue in our legs, we should listen to those signals and get them checked out sooner rather than later. Our legs and feet are not just tools for movement. They are messengers. When they start giving us warning signs like cramping or pain, they may be telling us something much bigger about our health. By paying attention to these signals, seeking medical advice when necessary, and making proactive changes in our lifestyles, we can protect not only the health of our legs, but the health of our entire body. Now that we've touched on cramping as a sign of concern, let's shift our focus to another critical warning. When a wound on your foot doesn't heal. Picture this: you accidentally step on something sharp, maybe a piece of glass. Your natural reaction would be to pull your foot away, clean the cut, and give it time to heal. Typically, within a week or so, you'd expect that wound to close up and disappear, right? But when days go by and you see no progress, or worse, it starts to look infected, that's when alarms should be going off. This is your body telling you something deeper is wrong. It's not just about the cut anymore. It's about how your body is healing or not healing. This situation becomes particularly dangerous for individuals with diabetes. You see, many people with diabetes suffer from nerve damage known as neuropathy, which can make it difficult or even impossible to feel pain in certain areas, especially the feet. So you might have a wound festering without even realizing it. That loss of sensation is due to damaged nerves, and those nerves are damaged because the blood vessels that are supposed to feed them aren't working properly. Imagine your nerves as thirsty plants that need water. Without proper blood flow, those plants start to wilt and die. The same thing happens with your nerves when blood vessels are blocked or damaged. When we think about healing, it's more than just skin deep. For a wound to close, your body needs to build new blood vessels in a process called angiogenesis. This is the body's natural way of making sure that fresh blood, rich with nutrients and oxygen, reaches the damaged area to help it heal. However, when someone has diabetes, the blood vessels themselves may be compromised. They don't grow as they should, and as a result, the healing process slows down or stalls completely. This explains why what seems like a minor cut can linger for weeks or even months without healing. But we have to zoom out and look at what's happening at the cellular level. The lining of our blood vessels, called the endothelium, plays a crucial role in maintaining healthy blood flow. When this lining is damaged, the blood vessels become sticky and prone to forming clots. Think of it as a roadblock for your blood flow. In someone with diabetes, these roadblocks are more frequent, especially in the smaller vessels that supply blood to the nerves. When blood can't reach the nerves begin to deteriorate. This sets up a vicious cycle. Poor circulation leads to nerve damage. Nerve damage leads to a lack of sensation, and a lack of sensation means you don't notice wounds, which then don't heal properly. If we think about the feet specifically, they are particularly vulnerable. The feet are farthest from the heart, so they naturally get less blood flow than other parts of the body. When circulation is already compromised due to diabetes, the feet bear the brunt of it. A wound that goes unnoticed can quickly become infected. Without proper intervention, the infection can spread, leading to ulcers or worse, amputation. This is why paying attention to slow-healing wounds is so critical. It's not just a matter of dealing with a cut. It's about preventing severe, life-altering complications down the road. We should be aware that the body is a finely tuned system, And when one part begins to fail, it can have cascading effects throughout the rest of the system. Poor blood circulation doesn't only affect the feet, it's a reflection of the overall health of your vascular system. And if blood flow is impaired in the feet, it could also be compromised in other vital areas like the heart or brain. What starts as a simple cut can become a window into the broader issue of vascular health. When blood vessels are struggling, the body's ability to repair and regenerate tissue diminishes. And that's when long-term health risks increase. If you or someone you care about is managing diabetes, paying close attention to foot health should become a priority. Regular self-examinations, wearing shoes that protect the feet, and acting quickly at the first sign of a non-healing wound can truly make a difference. The earlier we catch these issues, the better the chances are of preventing serious complications. It's all interconnected. Blood vessel health, nerve function, and wound healing are like a delicate dance, and when one partner stumbles, the entire rhythm is thrown off. Being proactive is key. There are practical steps we can take to protect our vascular health. For instance, keeping blood sugar levels under control, staying active to promote circulation, and ensuring that our skin is well cared for are all crucial in preventing foot complications. By focusing on these aspects, we can greatly reduce the risk of wounds becoming a bigger issue. It's not just about reacting to a problem once it arises, but about setting ourselves up for better outcomes in the first place. We should also appreciate the bigger picture here. Every part of our body is connected, and when we take care of one area, like our blood vessels, we're really taking care of the whole. It's not just about the foot or the cut, or even the nerves. It's about our entire system working in harmony. When we maintain good circulation, we preserve nerve health. And when our nerves are healthy, we're less likely to face dangerous complications from something as small as a foot wound. Let's talk about something that may not seem immediately concerning but could have profound consequences if ignored: the health of our feet, especially for those living with diabetes or circulatory problems. We often take our feet for granted, and yet they bear the weight of our entire body every day, carrying us through life. When something goes wrong with them, it's not always obvious, particularly for people with diabetes. We may not feel a small injury, a cut, a scrape, or even something as dangerous as stepping on a nail. Nerve damage from diabetes, known as neuropathy, can make us lose feeling in our feet, and that can lead to serious complications. Imagine this scenario. We're going about our daily routine, completely unaware that we've injured ourselves. There's no pain, no immediate sign of trouble. But over time, that unnoticed cut can turn into a wound that refuses to heal. Days, maybe even weeks pass, and we finally realize something is wrong when we notice a foul odor coming from our foot. By then, the wound has become infected, and the surrounding tissue may have started to decay. This is a harsh reality for many people with diabetes, and it's a scenario that's all too common but rarely discussed openly. The silence around this issue can make it even more dangerous. Now, we might wonder, why don't we talk more about these foot issues? Well, part of the problem is that many healthcare providers aren't trained to recognize or properly treat these types of wounds. Diabetic foot ulcers in particular require specialized care. It's not just a matter of keeping the wound clean and applying a bandage. We need a much more comprehensive approach, which is why specialized wound clinics exist. These clinics are staffed by experts who understand the complexities of chronic wounds, and they know how to intervene before things escalate to a point where surgery or amputation might become necessary. One thing that can't be stressed enough is how crucial early intervention is. If we have a wound that's not healing, we shouldn't wait until it becomes severely infected. Specialized treatments, like debridement, which involves removing dead or infected tissue, can make a world of difference. There are also advanced therapies, such as growth factor gels, which promote healing by encouraging the development of new blood vessels in the affected area. These treatments can literally save limbs, but only if we act quickly and get the proper care. So, what can we do to prevent this from happening in the first place? For those with diabetes, regular foot inspections are key. Checking our feet daily, especially before bed or during showers, can help catch any issues early. It's a simple habit that can prevent a lot of suffering down the road. If we notice anything unusual, a cut, a blister, or even just some redness that won't go away, it's important to see a healthcare professional immediately. The earlier we catch it, the easier it will be to treat. Another thing we should be on the lookout for is swelling, particularly in the feet and ankles. Many of us may experience swelling from time to time, and sometimes it's nothing to worry about. For instance, long flights or sitting for extended periods can cause temporary swelling. But if the swelling doesn't go away, or if it's accompanied by other symptoms, it could be a sign of something more serious, like heart problems. This is especially true for a condition known as pedal edema. Pedal edema is when fluid builds up in the feet, causing them to swell. If pressing on the swollen area leaves a dent, this is called pitting edema, and it can be a red flag for heart issues. When the heart isn't pumping blood effectively, fluid can start to back up in the body, particularly in the lower extremities due to gravity. That's why it's important to pay attention to any unusual or persistent swelling. It might be our body's way of signaling that something is wrong with our cardiovascular system. Heart failure is one of those conditions that can sneak up on us, and swelling in the feet could be one of the earliest warning signs. It's easy to dismiss it as a minor inconvenience, especially when it doesn't seem to affect our daily lives at first. But if we notice swelling that lingers or keeps coming back, we should take it seriously and consult a doctor. The feet may be far from the heart, but they can reveal a lot about our overall health. This is not difficult stuff. It's common sense when the pump isn't working well. When the heart struggles to function effectively, blood tends to back up in the veins, leading to a buildup of fluid in the lower parts of the body, particularly the calves, ankles, and feet. That swelling you notice, especially when pressing on the area and seeing a dimple form, is a clear sign something isn't right, and that's our body's way of waving a red flag. Now, venous leg ulcers, unlike the more commonly recognized diabetic wounds, which are usually small, deep, and circular, venous leg ulcers can be broad, shallow, and oddly shaped, sometimes resembling an island or a sprawling map. These ulcers often form between the knee and the ankle, and they might not bleed, but they are no less serious. Many people, even some medical professionals, might not be familiar with them, but that doesn't make them any less critical to recognize. These ulcers point directly to a condition called venous insufficiency. Venous insufficiency occurs when the veins, tasked with sending blood back up to the heart, aren't doing their job properly. Blood isn't circulating as it should. Instead, it's pooling in the lower limbs. This happens because the small valves inside the veins that are supposed to prevent the blood from flowing backward stop working. Imagine trying to pump water uphill, but there's a blockage. The water starts to collect and stagnate. This is exactly what happens with venous insufficiency. The blood begins to gather in the veins, causing swelling and eventually leaking fluid into surrounding tissues. When this fluid accumulates in the legs, it starts to overwhelm the skin, making it fragile. Over time, the skin breaks down, which leads to the development of ulcers. These ulcers, unlike others we may be familiar with, cover a large surface area but remain shallow. They don't bleed profusely, but they're persistent and difficult to heal. They are often triggered by the smallest of injuries, perhaps a scrape or bump we didn't even notice at first. But due to the compromised circulation, the healing process is slowed, allowing these ulcers to become a chronic problem if left unchecked. If we spot these kinds of ulcers, it's essential that we don't brush them off. It's time to reach out to a healthcare provider. And if they don't feel confident managing the issue, we should seek out a wound care specialist. These experts are trained in addressing venous leg ulcers and can help tailor treatments specific to the condition. Wound care clinics are equipped with the knowledge and resources to manage these more complicated wounds, offering a variety of therapies to promote healing. If our doctor isn't familiar with local specialists, we can easily find associations online that list qualified wound care providers. One of the most straightforward yet effective treatments for venous insufficiency is compression therapy. We might not realize it, but the simple act of applying pressure to the legs can make a world of difference. By using compression stockings or bandages, we help support the veins and encourage blood flow back toward the heart. It's like giving our veins a helping hand, keeping the blood moving in the right direction, which in turn reduces swelling and prevents further fluid buildup. But sometimes, compression isn't enough. For more severe or stubborn ulcers, more advanced treatments may be necessary. These might include applying growth factors to the wound to speed up healing, using skin grafts, or even considering hyperbaric oxygen therapy. This last method, hyperbaric oxygen therapy, involves placing the body in a chamber where oxygen levels are increased under pressure. The extra oxygen helps the tissues heal faster by stimulating new blood vessel growth and improving circulation. As we stay alert to these issues, it's crucial that we also pay attention to other signs that may indicate trouble with our circulation. Take, for example, changes in skin color or temperature in the feet and legs. One particularly concerning sign is if the toes begin to turn black. This might be an indicator of peripheral arterial disease, PAD, a condition where the arteries become narrowed, limiting blood flow to the extremities. If left untreated, PAD can result in tissue death, leading to gangrene, a life-threatening condition that requires urgent medical care. By staying aware of the changes in our body, particularly when it comes to our legs and feet, we empower ourselves to take early action. Those aches, swelling, or ulcers aren't just minor annoyances. They're the body's way of communicating that something deeper is going on. And if we listen closely, we can prevent more serious complications down the road. This problem isn't isolated to the toes. It signifies broader issues with blood circulation throughout the body. Narrowed arteries don't just affect the feet. They can lead to much more serious conditions like heart attacks, strokes, and even cognitive decline. If you notice something unusual, like blackened toes, it's critical to consult a vascular surgeon. They specialize in assessing circulation and helping to address the root of the problem. Ignoring these signs could lead to dangerous complications that become harder to reverse as time goes on. Our bodies often speak to us quietly, and it's our job to listen closely. We often take our circulatory system for granted until something goes wrong. Blood flow touches every part of our health, from how we think to how we move. When something is off, it's easy to dismiss small symptoms, but they can be the early warning signs of bigger issues. The health of one part of the body reflects the health of the whole. A darkened toe may seem minor, but it could be an early signal that our arteries are struggling to keep up. When we understand that everything is connected, we start to appreciate the importance of acting early and not waiting for problems to escalate. What's incredible is that something as simple as the food we eat can make a significant difference in how well our circulation functions. Take roasted beets, for example. This isn't just about adding flavor to our meals. Beets are packed with natural nitrates, which help widen blood vessels and improve blood flow. So, when we enjoy dishes made with beets, we're actually supporting our body's ability to keep blood moving efficiently. Every bite becomes a small step toward better heart and vascular health. It's not just a meal. It's a proactive way to care for ourselves. Sometimes people feel uncertain about how to incorporate these beneficial foods into their diet. We stand in the grocery aisle, staring at these odd-looking vegetables, wondering how to turn them into something we'd actually enjoy eating. But cooking doesn't have to be complicated or intimidating. Roasted beets, for example, are incredibly easy to prepare, and there are endless ways to enhance their flavor. A drizzle of olive oil, a splash of balsamic vinegar, or even some fresh orange slices can transform them into a delicious, nourishing dish. Simple tweaks like these can turn a basic vegetable into a gourmet experience that feels both satisfying and health-boosting. What's even more fascinating is what happens inside our bodies when we consume foods like beets. When we chew them, the natural compounds in the beets are converted by bacteria in our mouths into nitric oxide, a molecule that plays a crucial role in widening our blood vessels. This means better blood flow, lower blood pressure, and improved oxygen delivery to our muscles and organs. Think about how this can impact someone with poor circulation, especially in their legs and feet. By choosing the right foods, we can make a real difference in how our body functions and feels day to day. But, like anything in life, balance is essential. While beets and spinach are excellent for improving circulation, they do contain oxalates, which in large amounts can lead to kidney stones or other concerns. The key is variety and moderation. We can enjoy the benefits of these nutrient-rich foods without overdoing it. If diet alone isn't enough, or if we have underlying health conditions, speaking with a healthcare professional is always a good idea. They can guide us on how to manage our circulation more effectively, perhaps even recommending treatments like blood thinners or medications that further support healthy blood flow. In addition to natural remedies, modern medicine offers incredible tools to support circulation. For example, there are devices that use electrical stimulation to encourage the growth of new blood vessels in areas where circulation is poor, like the legs. This technology offers hope for people who are dealing with severe circulation problems. Combined with dietary changes and lifestyle adjustments, these medical advancements can provide a comprehensive approach to tackling circulatory issues, giving us more options than ever before. What's exciting is how our food choices and medical technology are starting to intersect. We're living in a time when we can blend the best of both worlds. Natural solutions like a healthy diet alongside advanced treatments that work with our body's own healing processes. It's a reminder of just how adaptable and resilient our bodies are when given the right tools. Whether it's through the power of a nutrient-rich diet or cutting-edge medical interventions, we have more opportunities than ever to protect and enhance our health. Ultimately, the choices we make about how we care for our bodies will determine the quality of our lives. It's easy to overlook small signals like a darkened toe or occasional discomfort, but these are opportunities to tune in to what our body is trying to tell us. Taking action now can prevent more serious conditions down the road. We have the power to take control of our health by making informed decisions, whether it's through the foods we eat, the doctors we see, or the treatments we explore. So let's take this as an invitation to pay closer attention to our health. By making thoughtful choices and addressing issues early, we can set ourselves up for a healthier future. Circulation is at the heart of our well-being, and by nurturing it, we're taking one of the most important steps toward living our best lives, full of energy, vitality, and longevity. Every meal, every consultation, every decision is an investment in the body that carries us through life. Let's make it count.